But it is now my great honour to introduce my friend and ministerial colleague, the Honourable Victor Dominello. Minister Dominello is the Minister for Innovation and Better Regulation. That can mean many things to many people, and Victor has had a distinguished ministerial career, particularly in Aboriginal affairs, which enables him, I think, to bring a real client focus to his work now. We call him the DAC man. He is a very popular member of our cabinet because of his extraordinary capacity to contribute to all our work with his understanding of how the digital age can help deliver better services for the people of this state. So it's my great honour to introduce Minister Victor Dominello, and Victor, you have agreed to take some questions afterwards. So please, this is also your opportunity to ask some questions.
Well, thank you, Prue. I love Prue. Prue's one of the, after that introduction, I love her even more. The reality is Prue's one of the handful of cabinet ministers that have been there from day one since 2011. So we've been on a very eye-opening journey together, and she also makes an extraordinary contribution to the way government works and is an integral part of our success. So thank you very much, Prue. And can I just hasten to add that Minister Goward is one of the people that actually get it. And when I say it, there are a lot of us that still operate in 20th century systems. But Minister Goward gets the fact that we are now in the 21st century, in the digital age, and this is the great enabler, the great empower that we must embrace in order to get better outcomes for the people of New South Wales. When I was asked to address you today in relation to medical research, I just thought I'd do my own quick snapshot in terms of what are the sources of diseases out there. And I was surprised to know that there are 7 main sources. One is nutrition, another one is emotional stress, so obviously nutrition's food, etc., etc. Emotional stress like sleep. You've got toxins, man-made chemicals, apparently there's either 200 or 2,000 of them out there. Physical stress, trauma, heat, cold, free radicals, radiation, and then microbes, your viruses, your bacteria, your fungi, etc., etc. And when I think about those 7 categories that really contribute as to why people get diseases and illness, and really why you are in medical research, I think overwhelmingly the majority of those categories have environmental impacts or come from environmental sources. So whether it's toxins, that's not something innately in our body, that's something that we pick up in the environment. So if we were to go into a hospital and we were to do an analysis of a human body from head to toe, unless we really started marrying up data from where that body had been in the environment, we're really not understanding the full picture. The same with physical stress. Where has that person been in their work capacity? Have they been exposed to physical traumas that have impacted on something that there is part of their makeup now that has resulted in a disease or an illness? And you can go right through. But the reason I'm bringing all this together is because in order for us to really, truly understand and get to the bottom of medical research, we need to have all the pieces of the jigsaw on the table. And in a digital age, that means digitising everything as much as humanly possible that moves, so that when we do get to the quantum computers within about 8 years' time that have got 1 million times more capacity we've got now, they'll be able to process that information, that data much, much quicker. I can tell you right now that I'm taking that same approach in relation to building and construction. So many of you wouldn't know through my title, but essentially I'm responsible for building and construction in New South Wales. So right from builders, through the licensing of builders, through the certification of the construction, through to home warranty insurance and the like, and even dealing with fair trading and complaints and real estate agents and the whole ecosystem evolving around building and construction. And if I could just adapt what I've just said to you in relation to medical research to building and construction, you can see how different levers in that broad pattern will have an impact. So, for example, we have a problem in relation to home warranty insurance here in New South Wales. It's costing you and me $1.7 million a week because, every week there are people that are going, builders are going bankrupt. That means there's a claim on the fund, but the premiums don't cover that claim. And we are out of pocket $1.7 million a week. Now, if I said to you, what are the main causes of that? Well, I've got a data analytics centre here in New South Wales that has now looked at all the data, done some analysis, and they can tell me to about an 84% degree of certainty which builders are going to go bankrupt and therefore make a claim on the fund. And you'd be surprised to know that the builders that are likely to go bankrupt to a degree of 84% are those builders that are actually quite successful. They start out really successful. They build one building and then all of a sudden they do a great job, and then somebody says, hey, can you build another one for me? So they go from one building to another. Then all of a sudden they get about 5 or 6 people knocking on their door. And then what you see is they don't become a builder, they become a manager. And they don't have managerial skills. And that's when they fall over. But how do we find out where those builders are in the pipeline? Well, if I could digitise the certification system, which we are doing now, I can then find out in real time through every critical stage of certification which builder is on time and which one's behind time. Then I can find out the builders that are behind time, are they the ones that have just started in their building journey? Have they accelerated up, or are they an established builder? If they are one of the ones that are starting to accelerate up and they're behind time, they're in that 84% category. Therefore, rather than wait for them to hit choppy waters, we can go and say to them, look, if we can help you out in relation to some management advice and some skill sets around management, then not only will you continue to operate as a successful builder, you won't go bankrupt, you won't have a massive problem on clients at the end of the journey. That's how you use data analytics in a digital way, just in building and construction. I can't even begin to imagine the range or the array of possibilities that would exist in medical research. But if you, for example, had that information, then that will empower you to unlock more riddles that we need to unlock. And the beauty about what you're doing here in medical research is that we all bleed. We all have bones. It's not just limited to Sydney, New South Wales. You come up with an idea, you unlock a key here, you can export that around the world for the benefit of all mankind. So thank you very much for inviting me to be here. This journey in many ways, and particularly in that big data analytics digital piece, has just started. Minister Goward's right. I'm an absolute zealot when it comes to this. And I can give you my word, we have just started the journey. Watch this space over the next few years, because I want not just to lead the country when it comes to this, but lead the world to show them how we digitise to get better outcomes for the people we're here to serve.